This poster is being presented by Michael Warburton, who's one of the tissue viability nurses in Cheshire, and myself, Liz Ovens, independent tissue viability nurse. It's entitled Improving Patient Tolerance to Therapeutic Compression Therapy Using Microcurrent Electrical Stimulation Therapy, Axial Heel Solo. Now we know that the gold standard therapy for lower limb leg ulceration, chronic venous insufficiency is graduated high compression therapy. However, we know many of these patients are unable to tolerate any or certainly therapeutic levels of compression due to pain caused by constrictions in the skin and edema. Although many patients are taking analgesias, and we know that even includes opioids, often not very beneficial or indeed successful, and they have many side effects, particularly for elderly patients. So we need to consider alternative options to manage these patients in order to facilitate the gold standard therapy of compression therapy. So Michael undertook a case study in the community for a patient with a recalcitrant venous leg ulcer, which was very, very painful. And he studied this patient over a period of time and used 3 consecutive axial heel solos back to back, providing a 36-day treatment. So the lady was 43-year-old with venous leg ulcers almost circumferentially to her right medial, lateral and posterior aspects, and these wounds have been present for 4 years. As you can see, she was a young lady, but she was unable to work. She previously worked in school kitchens, but due to the level of pain, she was unable to work and effectively became housebound. Her pain level was 10 out of 10 on the visual analog score, and she was unable to tolerate any form of compression therapy despite taking opioids. The wounds were quite extensive, 300 centimetres square and 4.8 centimetres. So the axial heel solo was commenced with reduced compression therapy of 20 millimetres of mercury. And as I say, she had 3 consecutive treatments over 36 days. During the therapy, the pain reduced by 50% to 5 out of 10. And in fact, the team were able to facilitate full therapeutic graduated compression with very good tolerance. Following the 36-day treatment, the larger wounds, the lateral and medial posterior aspects wounds, there was a 44% reduction in size, as you can see by the figures on to the right there. The pain score actually amazingly remained the same on the analog score, but she actually was able to discontinue her opioids and she started to mobilise and regain some of her independent life again. The wound 2 actually went on to heal, and the larger wounds then went on to improve further. And the plan was to apply a second therapy. And her day-to-day activities improved. She no longer felt isolated and she was able to attend her outpatient appointments with no problems. So we really need to think about alternative options to consider these patients to enable therapeutic compression therapy. Evidence has reported that up to 40% of healthcare professionals would actually discontinue or reduce compression therapy if the pain was unmanaged. We know that analgesia is poorly tolerated and often ineffective, so we need to think about alternative options of considering different treatments for pain management in this patient group. And this case study provides further evidence, already adding to the large evidence base there is for axial heel solo in reducing pain and the use of analgesics for these patients. And obviously it's demonstrating a very cost-effective solution for these patients. This lady had these ulcers for 4 years. And as you can see at the end there, the improvements to her quality of life were remarkable. And she'd been really concerned about being readmitted to hospital with sepsis, etc. And they were also diminished. So she was a very happy patient.